People living with type 1 diabetes are dependent on insulin. Some people with type 2 may also require insulin. It can be delivered using a pen, pump, and less commonly a syringe. There are many insulins with similar names, so double-check that you have the right person, right insulin, right dose, right time, and right device used in the right way. When insulin errors occur, it's often because of mistiming, incorrect dosing, or poor technique. But always remember that insulin should never be stopped unless you're instructed by a diabetes specialist clinician, especially for those with type 1 diabetes. Insulin deficiency can result in life-threatening diabetic ketoacidosis, or DKA. There are many different types of insulin. Each insulin has been prescribed for a particular person. They're not interchangeable. Be especially careful with insulins like these. They might sound similar, but are very different. Note that insulin is prescribed and measured in units, written out in full. The prescription will refer to the insulin concentration. This must not be mistaken for the insulin dose. Never draw insulin from a pen, because you could give a dangerously high dose of insulin by mistake. Most insulins are U100, which means that there are 100 units of insulin in 1 milliliter. However, some insulins are super concentrated and may be U200, U300, or even U500. If you're unsure about the insulin prescription device or dose, please check with a GP or diabetes team. Not all insulins are available from a pharmacy at the drop of a hat, especially on weekends. So think ahead when starting or changing insulins, or if supplies are running low. Insulin pens are either disposable, pre-filled with insulin, or reusable with insulin cartridges. Cartridges only fit the pen they were designed for. The cartridge pens can break, so people should have a backup pen prescribed for emergencies. Insulin should never be stored in the freezer, in direct sunlight, or near a heat source. If it freezes or gets too warm, it will not work. Keep unused insulin in the fridge away from the freezer section. If it's too cold when injected, it might sting, and cold mixed insulins take longer to resuspend. Insulin in use can usually be kept at room temperature for 28 days. Before giving an insulin injection, do a blood glucose test, but make sure that all parties wash their hands. If the reading is below 4 millimoles per litre, treat the hypo. If high, check what the care plan recommends and be ready to seek advice from the GP or diabetes team. Be particularly vigilant with people who are unwell, confused, or have dementia. It's easy to miss a hyper or hypo. The vast majority of people should be able to inject themselves using an insulin pen. For those who can't, district nurses, carers, or family members have to do it for them. A safety needle should be used to reduce needle stick injuries. Make sure you know how to use them. Incorrect use can result in missed insulin, a so-called wet injection, and risk of hyperglycemia, or for those with type 1, DKA. Needles are very fine and bend easily, so use a new one every time. Always do a 2-unit air shot to check the needle's not blocked and the pen's working properly. Insulin should be injected into subcutaneous tissue. Go deeper and you'll go into muscle and could cause a hypo. It's generally recommended that 4 to 6 millimeter needles are used, and the insulin is injected at a 90-degree angle. Hold the needle in the skin for a count of 10 after injecting, then remove it. Insulin can be injected into these areas. It's important to rotate the injection site to prevent lumps developing, which can affect the way the insulin is absorbed. A sharps box should be used to dispose of used needles after each injection. A few people are still using syringes and vials to administer insulin. If so, only an insulin syringe should be used. Normal syringes should never be used, as it's easy to draw up 10 times the dose. This has resulted in serious harm and is a never event. Some people use a subcutaneous insulin pump attached to their body, delivering fast-acting insulin continuously. Check that they have backup insulin pens in case of equipment failure. If the insulin pump is removed or malfunctions, the person will run out of insulin very quickly, and this can lead to DKA. Insulins are made to act at different speeds. This is why the timing of injecting the insulin is so important, to encourage more stable blood glucose levels and to avoid hypos and hypers. Long-acting and intermediate insulins are ideally given at the same time every day. These are not meal-dependent. Mixed insulin separates out. To work properly, it must be resuspended with a rocking motion of your wrist, and by rolling it from side to side 10 to 20 times. Mixed, rapid and short-acting insulin should be given before a meal. If you're giving insulin to a person, then you must coordinate with any carers providing meals. If insulin is given and the meal is delayed, there's a serious risk of the person having a hypo. If insulin is given after a meal, it can upset blood glucose levels. Make sure each person has an insulin passport. Keep it up to date and to hand. Inform the GP and diabetes team about any changes. It's your role to support people with diabetes to safely self-manage their insulin where possible. So ask yourself, has the right person got the right insulin? Are they able to give the right dose with the right device and the right needles at the right time and in the right way? Ask if you're not sure.